I made a video on this particular topic, 10 facts about the penis. And one of the subscribers asked, Nurse Mercy Mary, you said that the penis can break. Could you please expatiate more? Could you please tell us the causes? Could you please tell us the treatments? Good day everyone and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as the Nurse with the Difference. And I make learning easy and accessible for all my viewers. Today, we are going to be talking about the penis fracture or trauma to the penis. I'm going to be telling you the various causes, the type of sex styles that actually cause penis fracture, the signs and symptoms you are going to see as a man, and also the various treatments when it comes to penis fracture. But before we go into details into this class, if you are new on our YouTube channel, if this is your first time on our YouTube channel, please click on that subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Let's go there. Alright, welcome back. Like I earlier said, today I'm going to be explaining what penis fracture is all about. I know a lot of you will be like, how come you're telling us that the penis can break, whereas the penis does not have a bone in it? That is why I'm here. That's why I'm going to be making it simple for you to understand proper. Looking at the structure, looking at the picture showing on the screen now, what is showing on the screen is the internal structure of a man's penis. And this internal structure is made up of 3 cylinders. Are you seeing the 3 cylinders now? It's made up of 3 cylinders. 2 of these cylinder-shaped structures, they are known as the corpora cavernosa. Corpora cavernosa. While the last one is called corpus spongiosum. Corpus what? Spongiosum. So those 2 corpora cavernosa, during erection, when a man is erect, there's increased blood flow to those 2 cylinders. During erection, there's increased blood flow to those 2 cylinders that causes that erection, that makes you see a man's penis standing. So those 3 cylinders are surrounded by what is called tonical albuginea. Tonical albuginea. I'll drop the spelling here. I'm not an English student. They are surrounded by tonical albuginea. Those 3 cylinders that are found inside a man's pee, they are surrounded by what is called, by a tissue called tonical albuginea. So when that tonical albuginea breaks, then we say the penis has fractured or there's a trauma to the penis. So what is being affected in penile fracture is the tonical albuginea, the tissue surrounding those 3 cylinders found in the penis. So if you are a man and you never knew that there were cylinders, your penis is made up of the 3 cylinders, now you know. And when there is a breakage in that structure that surrounds it, that is where the word penile fracture originated. That's what it is simply talking about, the break in that tonical albuginea. And one thing you should know that is that penile fracture only occurs when the penis is erect. It does not occur when the penis is flaccid, when it's not erect. It only occurs when it is erect. This fact that a man's penis does not get erect every time is actually a good thing because it is protective. Because if it is like the man's penis is always like erect, it might lead to a lot of fracture. You've seen a lot of emergency like penis fracture every time. But thank goodness that it is not always erect. It also saves the man from embarrassment of walking around with erect penis and all that. But thank God. But I believe that if it was like that, it would be a norm. But thank God it is not like that. Then the other thing you want to know is that what is actually causing this penile fracture. Like I earlier said, for it to happen, it has to be erect. And what causes it? The first cause of it is vigorous sexual intercourse. Yeah, vigorous sexual intercourse. And research has shown that there are particular sex styles that leads to penis fracture, such as I think the cowgirl styles and the reverse cow. I'll look for a picture. Yeah, I'll look for a picture to explain it. Those sex styles actually lead to penis fracture. Then also intense masturbation, depending on how you masturbate as a man, can lead to penile fracture. Then also sleeping, for example, you are erect and you sleep on the penis, that can actually lead to penile fracture. So these are the various causes of a penile fracture. But in all, vigorous sex, in which the woman is on top, is the highest cause of penile fracture. Though it is rare, but it exists. It's not common, it's not popular, but it exists. You may now to ask, what are the signs and symptoms of this penile fracture? The first one is that you hear a pop sound, like a pop sound, like, okay, something has gone wrong. So that's the pop sound. There will be pain, like severe pain. There might be bruising, like you see bruising, you can see sore around that penis, like you can start seeing sore and bruising around that penis. Then also there can be blood coming out through the meatus. You can be having pain during urination. Those are the common signs you experience when there is a penile fracture. But that pop sound, maybe during vigorous sexual intercourse, you hear that pop sound, or during masturbation, you hear that pop sound. Please and please, it is an emergency something. It's not something you just stay at home and like, oh, it's going to be sorted out. So for the treatment, most times the treatment for this penile fracture is actually a surgery. Yes, it's a surgery. I've not seen a drugs that is being used for the treatment of penile fracture. It's a surgery in which the surgeons actually help to stitch. I think they are stitching it. The surgeons know what they are doing, but it's a surgery that that is being embarked upon as soon as possible to help it. Because if this person does not embark on this surgery as soon as possible, it can lead to erectile dysfunction. It can lead to what? It can lead to erectile dysfunction. So when you notice this sign, it could be during vigorous sex or whatsoever activities, please and please go to the emergency department so that they can do some imaging. They can do some imaging. They can do some MRI on the penis to really know what happened, to be sure that it is a penile fracture. I know you may want to ask, what are the complications that are likely going to arise from penile fracture? One of the complications I have here is a curved penis, because it's a penile fracture, like it's not bent. As a result of a complication like that can arise. Then also, this person might be having painful ejaculation, painful erection. Like painful erection after that. This person might be having erectile dysfunction, and also this person might be having what we call fistula. So these are the likely complications that are likely going to pop up when a person has what? Penile fracture. I think that subscriber that asked the question, it has been fully answered. I don't want you to be worried. I'm just here to educate you about it. It's rare. It doesn't occur like frequently. It's rare. But that doesn't mean it doesn't exist. But as a man, this is a knowledge that you should just keep in your mind in case something of such happen. And if it does happen, please and please see your doctor immediately. Whenever you're having sex or doing something and your penis is erect and you hear a pop sound, then pain, please and please don't just take it lightly. Try and see the doctor as soon as possible. Like I will always tell you, my channel is to educate you, but your doctors are in the best position to give you the advice that for a particular situation. I hope this video will give you an insight of what penis fracture is, the causes, and also the treatment of penis fracture. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye and see you in our next video.